So I will start the session with a presentation of some challenges that we may have in monitoring SRHR, and there will be basically two parts in that. First, I will present some work that we did with ICRH, the International Center for Reproductive Health, and colleagues of other WHO collaborating centers in the Euro region. And I'll come back to that in a minute. And the second part will be looking at the SDGs and some challenges that we have in monitoring these. It's merely meant to bring up questions for discussion, so food for thought, some answers, but to a large extent additional questions. So the first part is focusing on the WHO Euro region, which is a very broad region. It's much more than the European Union. It consists of 53 member states. And in the last 12 months, actually, 2 years actually, the Euro Office of the World Health Organization has drafted an action plan on SRHR. This action plan has been approved by member states, I think 2 or 3 months ago. So you can have a look at it on the website of the Euro Office of WHO. But in the margin of that, there was a question on how to measure progress in the context of this framework, and so WHO reached out to the collaborating centers, which are academia, which are other research institutes that provide expert advice to the World Health Organization, and asked us to embark on this exercise of proposing indicators that would allow the member states and the World Health Organization to monitor progress in the context of this framework. So let me briefly present you the results and the process that we did. So basically, this is an overview here of the different members that were involved in this exercise. So there was the International Center for Reproductive Health, our organization, BZGA in Germany that many of you are familiar with. I guess there was a colleague from the Czech Republic at the Institute for the Care of Mother and Child, and Karolinska Institute that is represented here by Elin Larsen today. We worked also with Rutgers. Rutgers was commissioned to work on a literature review, literature search, which I will describe shortly. And then we invited several additional experts that joined in a scientific and technical advisory group as some kind of a Delphi approach to identify relevant indicators. So the timeline was as follows. There was a regional consultation on the framework organized by the World Health Organization Euro in their office in Copenhagen, and so based on that, the final framework was drafted. And using that information, we looked at indicators that would be appropriate for this. Now, there was kind of terms of references that were established was to list existing indicators. So we did a comprehensive review of that. To summarize why some of those indicators would be relevant, or some would completely be irrelevant and would not even have to be considered. We looked at the availability of these indicators in the different member states, and finally looked at the importance and relevance of each one of these indicators. So there was in March 2016 a literature search done by Rutgers. Following that, with the different collaborating centers, we reviewed the output of the literature search to reduce it to a set of indicators that would be elaborated upon. And with this information, we went to a scientific technical advisory group that was held here in Ghent with experts in order to come down to a limited number of indicators and draft the recommendations. So the literature search started with defining everything that needed to be collected for the indicator, and looking at existing documents, existing databases, everything that is out there, and clearly there is a lot out there, and there are many different organizations, many different initiatives that have compiled lists of SRHR indicators. But they're all different, and clearly all these organizations, all these initiatives start from one kind of focus on SRHR, and clearly will have many indicators on one aspect and much less on another aspect. So what we did was bring all these indicators together in one database, and we compared the goals of the action plan, the strategy that was developed here for the Euro region, with all these existing indicators, to see if what we wanted to measure was kind of already covered by existing indicators, and whether some gaps existed and would lead to the development of new indicators. So that was done very in relationship, in collaboration with BZGA and ourselves. So at the end of this exercise, there were 185 indicators that had been listed, and actually there were even more, but we focused on those that were directly related to SRHR. Out of these 185, which the collaborating centers, we decided to focus on 75 that we, as self-declared experts in a way, deemed the most relevant out of these 185. And so for each one of the 75, we looked at the representativeness, at the applicability, the scientific soundness, and the availability of these indicators. And these were very different for one indicator compared to another. What we saw was that for indicators related to maternal health, for instance, we had many indicators, and that were available for many countries. Other indicators were much less available. For instance, female genital mutilation or so was in there, but was certainly not very widely available. Okay, so based on all this, in our database we identified different categories, and the different categories looked at the level or the type of indicators that we had. A series of indicators were dealing with policy level, so how do policies integrate SRHR aspects? What kind of indicators do we have on that? Other indicators focusing on programs and services, to a certain extent more process-related indicators. We had indicators of utilization of services, so the use. In the previous closed session, we mentioned the importance of focusing on use rather than only focusing on access. And then also clearly the output and outcome, because in the end, you may have a use, but if that does not translate in the outcome that you want, it's kind of only an intermediate indicator, an intermediate process indicator, and not really looking at your objective, at your goal. Now, in addition to this division by category, we also made a division based on topics, and this was kind of rather arbitrary, like looking at the different clusters. I mean, other divisions might have been possible, but we looked at general indicators, and indicators that were really focused on maternal and perinatal health, indicators related to sexual education, so comprehensive sexual education, CSE, indicators on family planning and contraception, indicators on sexually transmittable diseases, on gender-based violence, including sexual violence, and also harmful practices, and then finally reproductive health, and that was both including male and female, because another finding was that many indicators target women, and very often men are excluded from these indicators. Okay, and this was deliberately something that we did not want to, a trap we did not want to fall into. For each one of these 75 indicators, we developed one-pagers, and this one-pagers kind of compiled all the information that was available. I mean, you cannot read it, but the point is just to see, to show you how we did this. So with the relevance, with the soundness, and also with a map showing what countries had this data available and how recent the data was. For some indicators, we saw that only countries in the east, like Kyrgyzstan, I think also Uzbekistan. So there were several countries there where DHS surveys, the demographic and health surveys, are being conducted that have very good data, and this is something that we, for instance, in Western Europe do not have. So it was not really valid to say that Western Europe would have better and more data than Eastern Europe. This was true for some indicators, but certainly not for all indicators. Now, what were the recommendations that we developed? Well, based on the 75, we recommended a subset of 25 indicators. WHO had actually asked us to come down to 10 indicators. Now, try to limit SRHR to 10 indicators. It's quite a challenge. So we decided not to do that and to go for 25 indicators that would represent what we want, and leave it to WHO to limit it to 10 if they wanted. In the end, they approved the 25. But I think that the pressure from governments to limit the number of indicators to collect was quite high. Of those 25 indicators, there are 6 that are also included in the indicators that are being used for the Sustainable Development Goals, and I'll come back to that in the second part of my presentation. And we clustered those indicators in 3 types. There were those indicators that were actually routinely collected already. And again, in the previous session, the closed session, there was these issues were discussed. A lot of data is routinely being collected, and which means that governments do not really need additional resources or major changes in their policy to collect that type of information. So 7 out of those 25 indicators fell under that cluster. A second cluster were indicators related to policy and programs. And those were indicators that provide some information on how SRHR topics are really included in country or member states' policies. And finally, and this was the biggest group, were 12 indicators based on knowledge, perceptions, and experiences. And I'll come back to that in a minute, because this was quite a challenging cluster. So the recommendations for routinely collected data were to look at total fertility rate, adolescent birth rate, maternal mortality ratio, neonatal mortality rate, C-section, prevalence of low birth weight, and HIV incidence. So we cover a relatively broad scope of SRHR topics here, and these are data that are actually collected on a routine basis, and for which we found that almost all 53 member states had data available. In some cases, there were some countries that did not have it, but I would say that for almost all these indicators, at least 50 out of the 53 member states had this data already at hand. Okay, so there's little issue in recommending that, and the 3 underlined blue ones are those that are also included in the global framework for the SDG indicators. Okay, so those are already 3 that countries will have to report upon in the context of the SDGs. So basically, it's part of the commitment to the SDGs that you will do what you can. You commit to reporting this information on a regular basis. The indicators that focused on policies and programs were first the adoption of the action plan. So is this action plan that WHO drafted for the European region, together with different member states, was that formally adopted by governments? And by formally adopted, we mean, is it really included in laws, in policies, in guidelines? So how does a country address that? Out of the 53, there were 3 countries that did not approve with the action plan. They didn't block it, but they did not approve with it. Does the law prohibit discrimination on the basis of gender? What are the grounds under which abortion is legal? Do we have parental leave policies? I think that in the previous session there was a presentation on breastfeeding policies, so this is kind of closely related to that. The existence of a referral system for holistic care in case of sexual violence, and also the inclusion of HPV vaccination in national vaccination programs. Again, a relatively broad scope of SRHR topics, and what we suggested was to collect this kind of information on a 3-yearly basis, because we do not really expect policies to change on an annual basis, but also to urge countries to clearly mention it, to clearly elaborate and transfer information on when policies have changed, and to work together with civil society organizations to inform us on this and to follow these trends in national policies. Now the third cluster, as I said, this was a challenging one, knowledge, perceptions and experiences. What came out of the discussion during the technical advisory group meeting, and also during discussion when we presented our results at WHO, was that knowledge, perceptions and experiences are really considered as extremely important indicators. It's extremely important topics. It's basically the underlying determinants of the outcomes. If we only focus on outcomes, we're too late. The problems have already happened. So we should try to identify the underlying issues. So what was proposed was to look at the proportion of adolescents and young adults who had sexual intercourse before the age of 16, young people with basic knowledge of SRHR, those that received CSE in schools, the proportion of women who have their need for family planning satisfied, which is also an SDG indicator, proportion of mother contraceptive methods used at first and most recent intercourse, contraceptive prevalence, antenatal care coverage, frequency of induced abortions, which was a tricky one. As you may expect, some member states did not really see the importance of including abortion in that. I guess you may know what member states were those. And then unmet need for fertility services. Fertility services are becoming increasingly important, and so infertility and how to address infertility were certainly also at stake in the action plan of the WHO. Use of condom at most recent intercourse, and then 2 additional indicators that are also included in the SDG: the prevalence of intimate partner violence and the proportion of young women and men that experienced sexual violence by age 18. So those 2 are also included in the SDG. Now the problem with this is that this is information that is not just readily available. How will we collect this? This is information that we probably will have to collect through surveys. And so the discussion we had with WHO with the member states during meeting with WHO was how can we kind of urge the different governments, different countries to collect this type of information? How can we convince them to make resources available for this? And the answer is pretty easy and pretty simple. And it's the global indicator framework for the SDGs. As I said, several of the indicators are included in the SDGs. The framework here is a framework that was developed and presented earlier this year, including 241 indicators that cover all 17 SDGs. So we have the 17 SDGs with 169 targets and 241 indicators. It was developed by the Interagency and Expert Group on Sustainable Development Goal Indicators. And if you look at this whole list of 241 indicators, you see that basically 21 of those relate to a certain extent to SRHR. They're not all in one goal, they're spread across different goals. And again, you can make a distinction between those that are routinely collected, and we see indicators on social protection, for instance, pregnant women. We see the indicators on maternal mortality and neonatal mortality, which we had also suggested as indicators for the Euro region, but also proportion of births attended by skilled personnel, under 5 mortality, adolescent birth rate, and coverage of essential health services, which also includes, of course, SRHR services. So again, this is information that is relatively routinely collected and kind of easy to to present. The second group, again, policies and programs. We see two indicators in the SDG, one on education for sustainable development, also including the gender equality and human rights. And then a second indicator looking at the laws and regulations that guarantee access to SRHR services. Again, look at the specification here that guarantee women access to SRHR. As I said, there's a strong lobby to focus mainly on women, which is probably something that we as network might put in question. But the biggest list is the list of indicators that we could consider as survey-based data. Indicators for which surveys will have to be conducted. There's no other way of collecting this information. There's no routinely or system of routine data collection that will allow to identify this. And this is information on whether or not family planning needs are met. I mean, to know if it's met, you first need to know what the intention of the couple is. Do they want additional children or not? It's different from just contraceptive prevalence. Has violence occurred? Intimate partner violence. I mean, how do you measure that? We know that it's very underreported in official statistics. So you really need to have tools and approaches to collect that through specific surveys. The number of child marriages and female genital mutilation. Our colleague Al Slay has been working in the previous years on developing a methodology of estimating the prevalence of FGM in the European region. And you may not be surprised that it is very, very challenging, and you may end up with very different estimations. To what extent do you feel that you can make your own informed decisions with respect to sexual relations? This is something that is not easily measurable. But then again, it's included in this framework, so countries should do what they can to have that. And so you see a number of additional indicators. Now, it's clear that in order to collect that information, we will need uniform data collection protocols. We will need standard and general frameworks countries can use to collect this type of information. If every country separately starts building tools and systems to collect this, comparability is heavily compromised. So we need this kind of global approach to propose protocols and tools. But clearly, this will require resources. And again, the commitment to the SDGs also includes a commitment to accountability and to be willing to monitor this to show that progress is being made. So countries have, to a certain extent, the obligation of making resources available. And then finally, I think extremely important there is disaggregation. Throughout the indicators and also in the general content, the general introduction to the indicators, disaggregation is a major issue. We know that inequity is a very important and very, very significant issue, and particularly in the case of SRHR. And therefore it's extremely important to have data on specific groups. And so some of those groups are young people who are by definition an important group with respect to SRHR. Refugees and migrants, we know that refugees and migrants in many situations do have poor access to SRHR services, to health services in general. So we should find ways in really targeting those groups and collecting data on those groups. Women of reproductive age, many of the indicators are specifically with a denominator of women of reproductive age. This means that we will have to do surveys targeting just those women to have an adequate denominator. And we will have to find tools, to find sampling approaches to target just those women in a very cost-efficient way. And finally, HIV risk groups. This is probably one of the most challenging groups. How do you reach these groups? How do you reach female sex workers? How do you reach drug users? How do you reach MSM in contexts where MSM is legally prohibited and is non-existent according to some? So how do we target? How do we have this group? So these are important challenges that we have to consider if we want an adequate monitoring. And so in this context, the SDG Global Framework also identified 3 tiers in those indicators, and so all indicators were allocated to one of those. In the first one, they said an established methodology exists and data are already widely available. So these are kind of the routinely collected data. Okay, so this is basically easy. We can do what we've been doing for many years and just collect that. The second one is where a methodology has been established, but still we lack the commitment, we lack resources to collect that. So there, what we basically need is a strong commitment, or possibly ways in which we can make the methodology more cost efficient to sell it to the policymakers to invest in measuring this. But the challenging one is the third one, where no methodology has yet been developed, and therefore nothing is available. And I think that if we go back to the lists I just presented, many of these indicators fall under that third tier. And so this means that there's still much work to do. And let me finish with this, and this is directly taken from the report of the Interagency and Expert Group. And they say that this work will have to be accompanied by capacity building efforts. In addition, new data sources and technologies for data collection will need to be explored, including through partnerships with civil society, the private sector, and academia. And I think that this is a clear call for us as a network, as an academia network, to invest in this and to contribute to the development of this new indicator framework. So thank you very much. I think we'll have a discussion afterwards.